patient is a 15-year-old Asian male. For cardiovascular assessment, I first start by taking a patient history. I'd ask him, are both sets of your grandparents alive?
No.
And I'd ask him why.
Heart attack.
Then I'd move on to asking if there was any history of high blood pressure in his family.
Yes.
And then I'd ask him who.
My mother.
Next, I'd move on to ask him if there were any history of high cholesterol in his family.
Yes.
And I'd ask him who.
My mother.
And then history of diabetes.
Yes.
And who.
My father.
Okay. Next, I'd move on to check his capillary refill. To check his capillary refill, I'd take his finger and I'd press down in the nail bed. And I'd check to see if the color would return within 1 or 2 seconds. After that, I'd move on to check his carotid arteries, palpating each side one at a time. And not both, so I just not to cut off blood flow. After that, I'd listen to each side one at a time. Checking for any turbulent blood flow. After checking his carotid arteries, I'd move on to his peripheral pulse. I would use the radial pulse, the brachial pulse, the femoral pulse, which is located in the groin region, the popliteal, which is behind the knee, which is pretty deep, so you have to get really in there, his pedal pulse on the top of his foot above his big toe, just press real lightly so you can feel it, and then the tibial pulse right behind the ankle. After that, I move to the apical pulse by asking him to lie down slightly on his left side with his left arm over his head. To palpate the apical pulse, which is also called the PMI, I check in the fifth intercostal space along the midclavicular line to see if I can feel it. This is made by the heart pumping going like this along the chest wall. After that, I ask him to sit up, and then I would listen to his heart sounds. First, I would start in the aortic region in the second intercostal space along the right sternal border. Next, I move along to the pulmonic region, which is in the second intercostal space along the left sternal border. Next, I would move down to the tricuspid area in the fourth intercostal space along the left sternal border. And then lastly, I'd move on to the mitral area, which is in the fifth intercostal space along the midclavicular line. When listening to the heart sounds, I would listen for any heart murmurs, but normally you would only hear S1 and S2. S1 being best heard down at the apex of the heart, and S2 up here at the base of the heart. And that's a cardiovascular assessment.